Hello, I'm Anastasia Perez, and my topic for this semester is workplace violence. This is very important to me because it is common in the healthcare field where I work. I want people to take away from this public service announcement that it's okay to get help and that you should report any violence that happens at work. Even non-hospital workplaces have violence. Emergency workers are at huge risk for violence, and most report physical violence at some point in their career. Healthcare workers are at very high risk of violence at their workplace, and most violence happens from people that have a genuine reason to be in that place, such as a patient in the hospital. Nurses and nursing aides face the most patient contact time and thus the most violence. Healthcare workers underreport workplace violence. There is fear of retribution from non-supportive supervisors and companies that do not listen to complaints or do nothing. Only 30% of nurses, 26% of physicians report workplace violence. Part of the problem is a healthcare culture that thinks violence is part of the job. According to the Bureau of Labor Statistics, 15,980 workers in the private industry experienced trauma from non-fatal workplace violence in 2014. These incidents required days away from work. Of those victims who experienced trauma from workplace violence, 67% were female, 69% worked in the healthcare and social assistance industry, and 23% required 31 or more days away from work to recover. According to the Bureau of Labor Statistics, 409 workers in private industry and government were workplace homicide victims in 2014. The 5 E's are engineering, enforcement, education, economic incentives, and emergency. Applying these to workplace violence is not that hard. Engineering would mean that to prevent workplace violence, you would create buildings and systems of work that protected the workers and prevented violence. Things like bigger waiting rooms, not having heavy objects that can be thrown in the room, and design that allows for more than one exit from a space all contribute to more safety at work. Enforcement would mean following rules requiring violence. This would probably require reporting workplace violence and verbal threats, and follow through from management to help resolve issues with patients that are not happy. Education is key. All staff in healthcare should receive training in how to dissolve a stressful situation and manage aggressive behavior in their patients. Economic incentives. This could be provided to hospitals that have good systems of training, education, and also prevention methods for workplace violence. Perhaps hospitals that have good reporting systems and good follow-through could receive a tax break. The other way to do this is to fine places that don't do a good job. And in emergencies, yes, even workplace violence can end in death. So calling for help when you need it is appropriate. Medical teams may be needed, and also police and other agencies. You can find more information about this topic on the OSHA website, www.osha.gov/dsg/workplace_violence.html. The World Health Organization also has sections on violence and injury prevention in the workplace. There is a team of training materials provided at hss/us.com/healthcare/security. And also the CDC website at www.cdc.gov/NIOSH www.anastasia.com/topics/violence/training. Thanks everybody for watching, and remember, get help before you get hurt.